All right. Welcome, everybody. Welcome to this career panel. I'm thrilled to introduce our panel. First off, I'm Jen Top, Assistant Director of Student Experiences in the College of Health. And Dean Dolan and I are pleased to welcome Rear Admiral Richard Shobitz. He is Director of the Commissioned Corps Headquarters, and he's as Director of the Commissioned Corps Headquarters. Rear Admiral Richard Shobitz directs all functions regarding personnel, administration, operations, readiness, deployment, and policy for approximately 600 members of the U.S. Public Health Service. He's the principal advisor to the Surgeon General on activities and policies related to USPHS Commission Corps training, preparedness, activation, deployment, and total force fitness. Before becoming director of CCHQ, Rear Admiral Shobitz served as a board-certified clinical psychologist and deputy chief, Department of Behavioral Health at Brooke Army Medical Center, and deputy installment director of psychological health, Joint Base San Antonio, Fort Sam, Houston. Prior to joining USPHS Commissioned Corps, uh, Rear Admiral Shobitz served in the U.S. Army as the division psychologist with the 25th Infantry Division at Schofield Barracks, Hawaii. He earned a Bachelor of Arts in Psychology from the College of William and Mary and Master of Science and Doctor of Philosophy degrees in Clinical Psychology from Virginia Commonwealth University. He is also a proud husband to his wife, Elizabeth, and father to his son, Colton, and daughter, Lily. Stephanie Shell is also joining us, and she is the deputy secretary for administration at the PA Department of Human Services that assists Pennsylvanians with leading safe, healthy, and productive lives through equitable, trauma-informed, and outcome-focused services while being an accountable steward of Commonwealth resources. A social worker by training, her passion is to lift Governor Shapiro's and Secretary Arkush's vision for ensuring that each person living in the Keystone State has what they need to live safe, healthy, and independent lives, free of discrimination and inequity. Her prior work background in human services and public health includes leadership roles in consulting, strategy development, community engagement, and organizational advancement. And then finally, we have David Cinnamon. David is the health director of the the Allentown Health Bureau since 2022. He served as the injury prevention manager at the Allentown Health Bureau since 2014, focusing on programming related to child passenger safety, elderly falls, prescription drug abuse, home safety, and child abuse prevention. Before that, he worked at the PA chapter of the American Academy of Pediatrics, focusing on child passenger safety initiatives throughout Pennsylvania. David received his Master's of Public Health from Drexel in Philadelphia. So we have a great panel. And if you have questions as we go along, we will leave time at the end for questions. But if you're like me and you're afraid you won't remember what your question is, go ahead and put it in the Q&A section down below, and we promise we'll get to it. All right, take it away, Dean Dolan. You are on mute.
It's Monday. Thanks for joining us. If you can't see the Q&A, you probably know to click on the More button with the dots, and then you can open the Q&A. So look forward to receiving your questions as we go here. But for the panelists, I just want to start out by if we could hear more about your career path. You could start with your first job. We heard something about education. If you want to remind us what your major was as an undergrad, that's great. But what was your first job? How did things progress to where you are now? So I'm going to start with Dave.
Yeah, hi everyone. I got my undergrad at the Indiana University of Pennsylvania, and I had a focus on political science, pre-law, and economics. And I left there with a bachelor's, and I immediately got employed at a law firm as a researcher, and very quickly realized I did not want to do anything in the legal field. Um, And at that time, I was not too excited about doing anything with politics, either local or in DC. So, but I was interested. I'd done a lot of volunteer work with different health things throughout my teenage years. So I was Googling like what can I do in the health field that doesn't require me to be better at math or science? And I found something called public health. At the time, Drexel had a newer public health school, and I found it very interesting because it was not something I'd ever come across before. So I took a risk and left my job and went to public health school full time for 2 years in Drexel. At that time, I believe they had four focuses, and again, math and science weren't my strong suit, so I steered away from the bio epi path and kind of focused on the policy or community health side of public health. Um, and then after that, like I said, I was employed by or like the intro said, I was employed by the PA chapter of American Academy of Pediatrics, doing child passenger safety work, which for a layperson is car seats. And so there's a lot of investment in car seat education and making sure people get their car seats correct because motor vehicle fatalities and injuries are a huge issue still, even after decades of improvement. So I did that work for several years, and then my that work led me to Allentown. So and getting the job as the injury prevention manager, where there was car seats involved in that, but unintentional injuries are the number one leading cause of hospitalization and death, or it was pre-COVID. Things have shifted now, but and amongst certain age groups and cohorts, it still is. So elderly falls, car accidents, things of that nature. Different CDC funding streams were funding my work, and funding streams from the state for different initiatives, doing home visits with families to make sure, because one of the most common places I won't give you all a lecture on injury, but one of the most common places you're going to get injured is in your home, right? So we do home visits for seniors and children and young families and things like that. And then during COVID, I was given the responsibility of running our mass vaccination site here in Allentown at Ag Hall, and did a lot of good work with that, which put me on the radar to become the next health director. And now I'm here talking to you all. Is that all? I was just supposed to say what my path was, right? Okay, there we go. You're on mute, Beth.
Why don't you pick the next person to speak? Thanks.
And we'll go to Stephanie.
That's great. Thanks. And I'm so interested in hearing your path. Um, but yeah, so it's great to talk with you all. And I love talking about my career path because it's been sort of unplanned, and I don't know, I found it pretty interesting. I am actually from California. So I did my undergrad at the University of California at Santa Cruz. And I
Hmm.
majored in a major that I think only exists there, which is called community studies, which is a study of community change, of social change.
Hmm.
So one of the interesting things about this major was we spent our second to last semester doing a full-time practicum somewhere that you sort of documented and wrote about, and then you had to write a thesis based on that practicum. So I was able to do a practicum at a shelter for women and children who were escaping domestic violence situations, and was particularly focused on the children who came into that shelter. So it was a fascinating experience. And when I graduated, I knew I wanted to do something with children, and particularly children who sort of were coming from challenging situations. But I was really torn between social work and education. So I decided to spend a year sort of exploring both of my interests, my professional interests. So I spent a year working two different jobs. One job, I stayed in the shelter I was working in. I was able to convince them to hire me as a children's advocate. So I was able to be hired working directly with the children in that shelter. And then I did a second job working in a local public school as a teacher's assistant. So I was able to sort of experience both and discovered almost immediately that teaching was not for me. It was too much. She had to be on every day. You couldn't have a bad day. It really didn't sort of fit with my style. So I ended up deciding to go into social work, and found myself in Pennsylvania at Bryn Mawr, getting my master's in social work there. And from there, I've really just sort of followed my initial interest with children. And one of the things I became particularly interested in when I was working in that shelter was what happened to the kids who ended up engaged with the child welfare situation. So we often had to make reports to child welfare. Sometimes kids would end up being removed from their family situation, and I became highly interested in sort of that system and what happened to children and families when they were engaged in child welfare. So um, my second year of graduate school, I was working in a child welfare agency. I ended up staying, convincing them to hire me. So stayed on as a child welfare caseworker. It was my first professional job out of graduate school, and was able to do direct service in that system. And from there, I have just followed that path. I ended up getting promoted into one position, then another position, ended up getting particularly interested in program development around the needs of children and families, particularly in Philadelphia, where I was working. And it was fascinating. It was fascinating. It was an incredible experience. And then at some point, I sort of felt like I had learned what I could learn. And I ended up deciding to leave the job I was in at the time, which was still at the same organization I did my practicum in second year of graduate school. And from there, I spent about 10 years doing my own consulting practice, working with a whole variety of nonprofits across mainly southeastern Pennsylvania, exposed me to a lot of different systems beyond just the traditional social services I had been working with. And I then ended up going back into a job after about 10 years because I found consulting fascinating, but also sort of isolating after a period of time. So I went back into a child welfare organization that was an incredible experience, but ended up being acquired by a very large public health organization. So I guess about 8 years ago, I ended up as the managing director of strategy development at Public Health Management Corporation, where I had just a crash course in public health, and was sort of fascinated to learn that I'd been doing public health most of my career and just really hadn't realized it. So I got sort of this very deep experience in public health, and had always been politically involved. And so when I had the opportunity to sort of move on into a public sector role in Governor Shapiro's administration, I was eager to jump into the role I'm in now. My first role working in government, even though I've worked with government for a lot of my career, and I've been through another crash course in what it's like working with government, and particularly the Medicaid system, public health, human services in Pennsylvania. Even though I work for the Department of Human Services, we cover a lot of what is considered traditional healthcare, public health. We work very closely with the Department of Health, which is where much of the public health work in Pennsylvania sits. So I'll look forward to talking more about the experiences I've had, but I think that's the short story of my career path. And Rear Admiral, I guess you're next.
All right, finally the button worked to click off mute. Thank you, Stephanie. And just sort of reflecting on the words you just shared, I too sort of fell into public health without knowing it. So I'm a clinical psychologist, much like a social worker. Was focused very much so on patient care and but really didn't realize that I was tiptoeing towards public health, even starting within graduate school. I went to Virginia Commonwealth University, which is in Richmond, Virginia, and my graduate school was supported by a HUD grant, which had me providing services in the basement of a very, very old inner city elementary school. I'm a clinical child psychologist by training, and so my focus really was on 12 and under. And right next to me were social work students, and we had an RN who was a professor that was kind of our lead. And we did a lot of community intervention in addition to the clinical work that we were doing, really focusing on developing partnerships with our university, with the community, and creating access to healthcare that otherwise wouldn't be there. So, and my lens was not quite as broad as it is now. I was really thinking I'm there to provide that individual care, but we were doing public health things. And then after Graduate school, I moved on. I followed my brother into the Army and did my residency at Tripler Army Medical Center. And again, focused a lot on clinical child psychology. And then was pretty much immediately upon graduating residency, was deployed to Iraq for 13 months. And in that experience, I definitely didn't work with kids anymore and got a lot of experience working with adults experiencing trauma, of course, as you would imagine, going to war. With that, though, I fell in love with part of the mission that our soldiers were doing that I think probably wasn't covered as much on the news, and that was they were in communities helping rebuild schools and hospitals, but really the schools was what caught my eye because they were creating opportunities for kids to go back to school and for girls to go to school. And so, in talking to one of my buddies, who was my boss at the time, he was a social worker. He said, you can do this same thing that you love back home in uniform, just in a different service. And that's how I found the U.S. Public Health Service. And I'm going to share a little bit more about what that is. But it was just sort of a unique path towards finding the service that I'm in. I will say that my parents would scratch their head if they could have seen me at age 12 saying that I would spend my adult life wearing a uniform every day. I think I lasted 6 weeks in the Cub Scouts, and I just couldn't sit still enough. So they do get the giggles a little bit. But it's been an exciting career path. And again, I think a lot of us just find public health because of where our heart and our passion takes us. And that, much like Stephanie, that's how I found where I'm at. So thank you for having me. Great to be here. Beth?
Yeah, thank you. Thank you so much for those, for telling us those stories. And one thing that I think is really you guys have in common here is that you made discoveries not in the classroom, but actually doing the work. And so, David discovered, yeah, law's not for him, right? And so went in a different direction. And Stephanie kind of compared social work with teaching and realized what she was best suited for. And then Rear Admiral Richard, you decided that, hey, you know what? There's something going on here with the rebuilding of schools and this broader effort that I'm really interested in after experiencing it. And so this is one reason the College of Health really tries to emphasize experiential learning while you're in school, because sometimes it's as important to find out you don't like something as it is to find out you do like something, right? But you don't have to have it figured out when you start your first job. That's my little summary takeaway from all those comments. So thank you so much. And now I think it'd be really interesting for everybody to hear more about each of your organizations and what is the mission and kind of what are the range of roles that it includes. And maybe we go backwards this time and start with Rear Admiral Richard.
Sure, happy to share. So, I think there was a typo in my bio. We actually have just under 6,000 officers nationwide. We are one of the 8 uniformed services. And the fun challenge, if we were all in a room together, would to see if anybody could name them all. Everybody always misses the Public Health Service and the National Oceanographic and Atmospheric Administration, which
Oh,
is another great service that's out there doing scientific work. They're pretty tiny. But the Public Health Service, Commission Corps, our officers in their day-to-day jobs serve across federal agencies throughout the federal government. CDC, NIH, FDA doing incredible research, program development, all sorts of amazing things for our nation and really for the world. I'm getting emails on an international operation that the CDC is doing right now. And then other officers are providing direct patient care within the Indian Health Service, the Bureau of Prisons, the Coast Guard, Department of Homeland Security, really just providing the care that the nation needs. And what's unique about us is what makes us a uniform service is when the nation comes calling, if there's a natural disaster like a hurricane or tornado or even a train derailment or other things, we can be deployed in support of that work. And so we will, at a moment's notice, and we're on call, so we have months that we're on call, we're prepared to drop what we're doing in our day jobs. And then we will go to where we're needed. And so I have had the pleasure of deploying in support of hurricanes, a few of them. And we go for 2 to 4 weeks, sometimes a little bit longer. I've also, as a psychologist, have had the opportunity to deploy in tribal communities when there's been different issues that the communities have been facing. I've gone with small teams of behavioral health providers to team up with the local community leaders and to help them to get through whatever they're going through. So we really are a unique service in that even we wear uniforms, we don't carry weapons. That's not really our role, but we are in support of communities. I think really the way I put it is we go. We in our day jobs serve communities that are most in need, and then in when deployed, we walk towards human suffering and we provide support as needed. And it's an amazing honor. It's a job that it tires you out and it energizes you at the same time, but you certainly leave with your cup full. So I guess I get to pick the next person, and going backwards, I'll turn it back over to Stephanie.
That's great. Thank you so much. Yeah, let me just share a little bit about the Department of Human Services in the Commonwealth of Pennsylvania, because it's impossible to sort of focus on one type of job or a couple types of job that exist because our department is so big and we do so much. So the Pennsylvania Department of Human Services, PADHS, is responsible for the, sort of some very core functions and offices in our Commonwealth. So if you boil it down just to sort of our simplest mission, we are responsible for making sure people in Pennsylvania have the food, the clothing, and the shelter they need to live healthy, successful lives, along with our support of health systems and the Medicaid program. So we have close to 18,000 people who work for the Department of Human Services. We serve over 3 million Pennsylvanians every single year. And we are home to 8 different program offices. So one of the offices is mine, the Department of Administration, where we sort of run all the core operations of DHS and provide a number of services that just require independence from other program offices. But we have sort of the heart of DHS are the program offices, which I'm just going to list them sort of quickly so you all understand what we work with. But our Office of Developmental Programs, which works with individuals who have cognitive and intellectual differences in Pennsylvania. We have our Office of Mental Health and Substance Abuse Services, which provides mental health and substance abuse services. We have our Office of Child Development and Early Learning, which is focused on the needs of young children. Our Office of Children, Youth, and Families, which is home to our child welfare system. Our Office of Medical Assistance Programs, which is home to our medical assistance programs, including Medicaid and Medicare. And I probably forgot an office, but that's sort of the basic scope. And we have positions really across the gamut, really sort of any type of job you could probably think of, we have somewhere within DHS. Everything from people who prepare food for our facilities. We run over 125 facilities across the Commonwealth. So we have positions everywhere in Pennsylvania, including facility-based, community-based. I know the biggest office I forgot to mention, which is probably makes up about a third of DHS, is our Office of Income Maintenance. So if you've ever heard of a county assistance office, which exists in every county in Pennsylvania and across the country, and is where individuals access all public benefits. So we have about 7,000 people who just simply work in our Office of Income Maintenance. But again, we have jobs everywhere, from high-level specialized medical jobs to jobs that require less training, undergrad, graduate, all sorts of jobs. So would love to talk more about that, I'm sure, later on in this, but that covers the question. So turn it over to you, Dave.
Yeah, so I am the director of the Allentown Health Bureau, and the Allentown Health Bureau is one of 11 county municipal health departments in the state of Pennsylvania. So to exist as a county or municipal health department, when I say county, so there are 7 county health departments, there's 4 municipal or city-based health departments, which Allentown is a city-based health department. So our jurisdiction is only the city of Allentown. Um, our primary core functions, which are given to us by state law, we exist under something called Act 315 and Act 12 in PA state law, is one, well, overarching to stop the spread of communicable diseases. Now, how do we do that? Well, there's one avenue, or what we call environmental health, which is restaurant inspections, right? Health inspectors with clipboards and hats literally go out to every restaurant and kitchen in the city and inspect them. We do that for every restaurant, kitchen that's in like a school cafeteria. We inspect every daycare that way as well. Even if they don't serve food, we inspect them for other compliance issues. And there's a whole litany of places that we inspect under that program. The other part of what we do under the umbrella of preventing communicable diseases is vaccination. So we offer adult and child immunizations through different clinics and promote and educate around those things. Now, that being said, the Health Bureau has 48 people now, and we get some funding from those two acts, Act 315 and Act 12, but to be able to expand our programs, we need to get a lot of other grants, which pulls us in a lot of different directions. So we do a lot of lead work with our environmental health people. So anytime a child in the city has, it would take me a very long time to list off everything we do, but real quick, every time a child in the city of Allentown has an elevated blood lead level, we do a home visit, and then there's a whole remediation program through the city of Allentown as well. On our personal side, we employ nurses, medical assistants, nurse practitioners, clerical staff, community health specialists, like community health field workers, as well as program managers for all the programs we run. And I will just kind of run through a ton of stuff we do. So, and a lot of this is kind of commingling with in-person education, coalition building. We do a lot of outreach to not only individuals but community groups and other agencies. Kind of strategic planning. So when we talk about some of the stuff we do, community, for instance, we do violence prevention work, but we don't have like violence interrupters. We're talking about how can the city look at violence issues and what can the city do from a municipal standpoint of changing environment and things like that. So we do violence prevention. We have unhoused services, which is a huge new part of what we do. Traditional public health work like maternal child health visits and um, education surrounding that with new moms and pregnant moms and young children. Um, Chronic disease. So we talk about nutrition, physical activity, diabetes, blood pressure. We do a lot of education around that. We have STD clinics, and that's another part of stopping the spread of communicable disease, right? We have STD, HIV clinics. We have a twice a week. We do a lot. We do a lot with, like I said before, my old position still exists. So we do a lot of outreach to uh, surrounding not only preventable injuries in the traditional sense, but we talk about drug overdoses a lot. We do a lot of work around promoting that and Narcan use and tracking overdose deaths and overdose incidents in the city. And then there's another huge part of what we do is public health emergency preparedness. So we get a lot of funding to make sure that we are training and drilling and planning surrounding public health emergencies and what that looks like and what we do with that. I'm sure I missed a lot, but yeah, that's it in a nutshell.
So it's incredibly impressive, and I think amazing to see the way that uh, government services are layered, from the local to the state to the federal level. We're in a time of questioning institutions, right? And I think it's so good to hear about and I'm not saying that's wrong, great, good for people to question things. And I think it's amazing to see the hard work that people are just doing day to day, to keep us all safe and healthy. So thank you guys for your work. It's incredibly impressive. So curious about just you personally, what does your day to day look like? So maybe we start with Stephanie on that. So what do you do day to day in your role?
So uh, no 2 days are alike, and I'm sure my colleagues would say the same thing. Every day is totally different. Working at DHS, um, and we really have to work. I think everybody who sort of works in the Department of Human Services and sort of across the Commonwealth of Pennsylvania under sort of the umbrella of government is really working from sort of three different perspectives. So the first is that we run facilities, we run programs, we provide direct services ourselves as a department. We have a network of state hospitals for adults who have psychiatric challenges. We run state centers for adults who have cognitive challenges. We run county assistance offices. We run child welfare facilities. So we have a lot of direct service work we do every single day. And that's clearly like sort of takes up a lot of our time and effort. At the same time, we're also utilizing that experience along with the experience and communication we have with all of our county partners and our provider partners to try and set policy that we believe is working Pennsylvania towards the healthiest spot possible. And then we are working with our partners in the legislature, our state representatives, our state senators, to hopefully turn some of that policy into actual legislation so that it is lasting and sustainable. We're sort of always having to work across those three pathways. If I really have to when I'm talking to young children, how I describe my job is that I just walk into my office every day and there's just this big mountain of problems that is sitting there. And what I do every day is just try and pull as many problems off that pile as possible with my team, and see how quickly and how many problems we can solve day to day. And sometimes problems take years, if not decades, to solve. And sometimes there's smaller problems that can be solved that day or that hour. And there's everything in between.
Well, if you get bored easily, that sounds like a good job for you. Always something different happening. Yeah. Do you want to choose who speaks next, Stephanie?
Sure. How about Dave? Let's go to you next.
Yeah, every day is different. I would say, and not even in a negative way, but it's a lot of putting out little fires, right? So, like I said, there's 46 people besides me that work at the Health Bureau, and they're all doing actual public health work, right? I no longer do actual public health work. I just try to make it easier for them to do actual public health work. And that's my job, right? So, if I whatever I can do from not only a programmatic standpoint, but also a staff management standpoint to make their jobs easier, to make the organization run better, is a lot of what my day to day is. Someone might come in and there might be a problem with a restaurant that I need to get involved in, or I need to address an issue with a provider that we're having, or um, a lot of it is also responding to questions from our elected officials or working on starting new programs or figuring out how we can be, again, like besides the in the minute, someone's coming into Dave's office and they've got a problem for me to solve. There's a lot of strategic thinking of, our budget passes, our budget just passed, right? But already it's February and I'm already planning out and thinking, what are our budget asks? What's our programmatic needs for 2027? And what is it going to look like if funding's cut, or what are the possible funding streams that we can go after to make the burden less on the taxpayer for the services that we provide? So there's a lot of strategic thinking I do from that. I don't just sit in the wall and think. I mean, I don't want I don't stare at the wall and think all day. But there's a lot of planning and talking about things of that nature, as well as how can we make our programs more effective, or taking ideas from our staff or our community and like listening to that feedback as far as what they want to see from us, what we can do more effectively, and how can we improve the programs we're already running. I think I just said a lot without saying a lot, but hopefully it made sense. And I'll turn it over to Richard.
Thanks, David. I'm smiling, thinking you mentioned you don't sit and stare at the wall and think a lot, but I actually think that that's an incredibly important thing for leaders to do, to actually have some time. And it's so hard to schedule time to think with jobs like we have. So my day too, it varies a lot. So I oversee recruitment and accessioning for all of our medical and public health professionals. So we have physicians, nurses, dentists, psychologists, social workers, physical therapists, you name it. We also have environmental health officers and engineers, believe it or not, are a critical component of what we've got. And we have them managing huge projects. Particular engineers in the Navajo Nation are working on a water sanitation project that's
Hmm.
bringing fresh drinking water to communities that, believe it or not, in this day of age, don't have access to fresh drinking water. They fill up tanks in their backs of their pickup trucks, and so we're working with the Navajo Nation to bring water to people. So lots of exciting stuff that we get to do. Really, a big part of what I do is supporting our agency leadership too, and figuring out what challenges are they facing, and how can we as the public health service, how can we potentially support them. The other thing that I do, so I do have a career management branch. My immediate office is about 100. And so I have a career management branch that will do all the promotions and awards and all the great stuff. I oversee all of the deployments of our officers too, which is to say someone else really does all the amazing work, and I'm there to support them and then to kind of problem solve at the higher level. I guess to illustrate kind of how dynamic it is, I'll just talk about my week last week. I was on travel and I started the week in Raleigh, North Carolina, meeting with the director of the health department there, just talking about how we can better partner with our state partners and make sure that they knew who we are and where we are because we're in their state right now doing things. And it's always good to be able to kind of share time together outside of an emergency situation. So when there is an emergency situation, we can be like cell phone to cell phone, just talking about how best to serve you. Then I went to Butner, North Carolina. There's a prison there, which is a huge, it's actually like a prison hospital with the Bureau of Prisons. Some of the most amazing people in public health are working in prisons. You don't think about it, but they're so dedicated to a very challenging mission. And so got to spend time with officers there. Then I went to Cherokee, the Indian Health Services Hospital there, and then rounded out my week in at a remote area medical mission where we had an NGO partnered with a whole bunch of other folks to provide care in a huge community center and creating access to care. Things like people came in and then left with dentures same day, and came in and left with glasses same day. All of the amazing things, and I got to see students working with preceptors and all across. So. Yeah, I have an exciting job. It definitely, like Stephanie, there's that pile of challenges that I try to convince myself that are opportunities when I'm getting stressed out. But it varies. The biggest thing that I get to do is just support our officers as they support our communities. So I love it.
Hmm. That's great. Yeah, so problem solving, strategic thinking, and then taking care of your people so they can take care of other people. It sounds like it's something y'all all have in common. Um, so we have a question, and the person says question for later, but I'm going to go ahead and ask it now. I think we'll just sprinkle them in as we go. And so the question is, a lot of you mentioned having staff with varied experiences or positions. What traits, skills, outlooks do you see in coworkers or hires who succeed or make a difference? And she's especially interested in what Dave has to say, but I think it'd be interesting for everybody to answer if you're willing. But let's start with Dave. So, like, how do people succeed in your house, you know?
Sure. I would say besides kind of the obvious traits that we look for in, someone who's a professional in the health bureau and community health specifically, um, you have to be flexible. There's a big, it's not for someone who can't not think on their feet, but can't adjust in the moment. You could, our nurses are constantly doing different stuff as far as going to daycares and doing inspections with environmental health people, or we might have someone walk down the street to the ER because the ER is not picking up their phone and there's someone there who might have TB and we need to talk to someone about it. So and we have communicable disease investigators that do just that. So, if we can't get someone on the phone, you've got to go knock on doors. So there's a level of social competency too, and not so much as, Allentown is a very ethnically and racially diverse city, but obviously you have to be aware of that, but being able to interact with people in an intelligent way is very important for community public health. Um, because especially the people that we see on a day-to-day basis, we may be telling them they have HIV or tuberculosis or an STD, or they're coming to us because they think they have one of those things. So interacting with them in a professional but empathetic way is something that I think is a trait I see across all my people. And I think empathy in an intelligent way, not overpowering empathy, but being able to understand where someone's coming from. And because public health messaging and appropriate public health information is so hard to get across to on a population level or an individual level. So when you have someone in a room or you're visiting their home or you're talking to a group of people, to be effective, you need to be able to relate to them. So I think that's one of the bigger things.
Yeah, helpful, really helpful. So, Stephanie or Rear Admiral Shobitz, do you guys have anything to add?
You know, well, Rear Admiral, if you don't mind me going first, I would just add that, from sort of the Commonwealth perspective, I think what is so helpful in employees and candidates for positions is people who are able to come in with a specific skill set that is clear, but that they're able to connect it sort to the bigger public health picture. Because we have jobs across so many different sectors within our department, but all of it has to sort of rise up and meet sort of the public health moment. So, for example, I have an architect on my team who is responsible for designs of our facilities. And, that's a very sort of clear cut role. But he's had to become an expert in, different furniture for people with physical differences or cognitive differences or emotional differences. He's had to become an expert in community concerns around having facilities in backyards of people's homes. So every role within our department is specific, but you succeed when you're able to connect it to the bigger, broader picture.
Hmm.
So that's what I would share.
Great, very helpful.
Yeah, for me, I think the two factors that would jump out, one is just compassion for people or even animals. We have veterinarians. And then a willingness and excitement about learning, no matter where you are in your career, because of what we do is so dynamic. When it comes to other factors, like whether someone's an introvert or an extrovert, or if someone's, there's so many different opportunities. We can help align someone up with the right opportunity. But if you have those two things, that compassion and the interest in learning, because it's, the problems we solve are ever changing. And so no single skill set will ever suffice. It's the next problem that's coming. It is, we just have to be willing to learn to be prepared for it. So thanks.
Yeah, great. So, so you guys each have a lot going on, I think it's fair to say, and day to day and overall, all very mission driven. I'm curious about what your favorite thing is about your job. Like what sort of brings you to work every day, ready to keep doing this very challenging work? And then also, are there areas of frustration that, are current maybe, or just that over time that you've experienced? So kind of getting the real view of it. I don't know who wants to go first. Feel free to jump in.
I'm happy to start. I'll start with my favorite. Like the best part of the job is just how crazy big and complex it is for me. Like you could never get bored working for the Department of Human Services in Pennsylvania. It's so big, it's so complex. And because of that, I think it sort of really connects the people who work there in a very, very deep way. So, for me, it's the complexity, but it also is like sort of the very strong relationships and connections I'm able to build with my team and the teams around us across the Commonwealth, sort of in support of managing work that's so complex. So I think that's certainly my favorite. I think what's hardest for me is the slow pace of government. Government is not fast, and the pace is just sort of is difficult sometimes. I don't have a ton of patience. I like to get things done quickly and efficiently, and it's been a real learning experience for me to have to learn how to sort of be patient and work more slowly and thoughtfully. And at the same time, I understand the importance of the slow pace. There's a lot of protection and guardrails that it provides.
Hmm. Interesting. Thank you.
I'm happy to jump in. For me, I love to catch people doing great things. When I get to hear the stories of the work my officers are doing in the field, and they sometimes are just way far away from me, but getting to hear the amazing work that they're doing, getting to call them and say thank you, that really does, it's fulfilling for me. For me, probably the biggest frustration. It's beyond just my organization. I think for many of us in public health and in healthcare, we always want to do more than we can do. And an example would be from my experience with the remote area medical mission. They knew that they had to turn people away at the end of the day, even though they saw thousands and thousands of people, but they couldn't do it all. And I think we see that across for folks that are interested in public health. We always want to be able to do more. And so I do try to reframe that for myself. That's that passion. I guess I would never want to give up that frustration because then maybe my candle's not burning as light as I'd like it to be. But it's there. It can be hard. You always want to be able to do more.
Mm, that makes sense.
I guess the most rewarding thing or the best thing about the job is when the programs you do have a real impact. The first thing that comes to mind is 3 years ago, we had an idea to start a public health paramedicine program where we hired some paramedics and instead of being on ambulances, they take referrals from hospitals, they take referrals from EMS, and they track high utilizers in the ERs, and they do home visits with them and things of that nature. And they work with the substance use population and the homeless population and the elderly population. And there's been a lot of great big and little wins that have come out of that. And it's a super popular program. And it's just really cool to see something like that started out of nowhere just have a huge impact on our community. What was the second part of the question?
Oh,
Biggest
what do you
struggles?
find frustrating?
Oh, local public health.
What do you mean? Say
Period.
more about
Yes.
that.
Yes. No, I mean, local public health. I mean, it wasn't easy pre-COVID. It hasn't gotten easier after COVID. We have the eternal struggle of, um, convincing the population to embrace um, public health issues that we have trouble communicating to them. It's the constant, I don't want to say failure, but it's the constant struggle of public health is how to communicate better to the population so they can embrace our messages and embrace better health practices. And working in an environment where since COVID, things haven't been as shiny as they should be for public health on a national level either. So, trying to find a way forward, but when you're doing the work every day and focused on the people you work with and the population you're serving, a lot of that stuff kind of gets drowned out. So,
Hmm. Yeah, I think that's true, and I can relate to that from a different, less consequential standpoint. But just dropping into the work, you know what I mean, is always kind of the answer. I think when things feel discouraging, you just drop in and you do the work, and you find your way kind of through that. So that's really interesting and fair. Um, so one of the questions we have is if you could share advice with students about how to navigate a difficult job market in public health. And I mean, that's a perception, right? That the job market is difficult in public health. And I think, first of all, maybe we just talk about, is that true? Do you think that's true? Um, and then you've given some advice about how to show up, at work with compassion, for example. So I think we have a start on this question, but just curious what you would add. Maybe we talk about the job market and public health in terms of how you're aware of it, what you know, and then if you have any advice for students who would want to look for jobs in this area.
oh, sorry, I'll just jump in. Sorry, because I talked to a lot of my fellow health directors across the Commonwealth, and the discussion surrounding building out the public health workforce is something we talk about all the time, and how many of them have trouble retaining staff, recruiting staff, things of that nature. I think that there's the expectation from people seeking jobs that public health jobs are going to be higher paying than they are, and they are not, especially when you're doing entry level stuff like community health worker jobs and things of that nature. Even, getting competitive wages for our community health nurses is difficult, right? So keeping up with what nurses and clinicians are being paid by major health networks is always um but there are jobs out there. But to get into I don't want to say it's something you have to work your way up in, but it kind of is, right? There's a lot of, depending on where you're looking and what state or area of this state or area of the country you're in, there's probably availability. It just depends on the type of job you're seeking out.
Mm, yep. Great. Anybody
I'm
else?
happy to jump in.
Yeah.
I would say um, we're always looking for talent, and I don't speak just on behalf of the Uniform Public Health Service, but with all of our federal partners, there's actually a need for talent, and some of it may be that entry level, particularly on the civilian side. I think when we wear uniforms, it might be a little bit higher to start because we also are, at a moment's notice can go to deploy to emergencies. But I think that's one of the biggest stressors that my partners all face is they can't actually find people to take on opportunities with emerging programs. And so I would challenge students to think outside the box, look at your local, your state, and your federal government options. For federal usajobs.gov has there's opportunities on there. I would also suggest maybe that first couple of jobs just trying different things that you may not think you would ever love, because you don't know where. I think if you talk to the three of us, David, Stephanie, and me, we probably all didn't realize that we were going to, this wasn't written on a map that we were going to
Yeah.
end up where we were at. We just kind of followed our hearts, and by doing that, it allowed us to try different things, have great experiences, and shaped where we're at. So there are opportunities out there. I promise. We need help. We need folks like these students once they graduate.
Yeah. That's great. Thank you.
Can I just add one thing? I just want to put a
Yeah.
plug in for thinking broadly. The beauty of public health is sort of how broad a tent it provides. Public health is interwoven into almost every facet of our lives, of our society. So please think outside just traditional public health when you're thinking about your career moves and your where you're applying what you're thinking about, because there's so many areas that need really strong public health thinking, human services, child welfare, traditional physical health, behavioral health. The list is endless. So be open, receptive, and don't pigeonhole yourself from day one.
Yeah, I love that. I know, and I've told this story before, maybe not to any of the students on this, but when I was a junior in college, I was absolutely freaking out about what I was meant to do and what, just whatever. And I called my father, I happened to be in Germany studying abroad, called my father, and he just said, look, take the next step that makes the most sense to you, and the rest of your life will unfold. And he's right, right? It was just a lovely way of saying what we're talking about here. So that's great advice. So we actually only have 3 minutes. So if anybody has a question, please, now's your time to post it. And while we're waiting to see if folks have questions, I would just ask you guys if you could be granted one wish for public health, what would it be? You have the magic wand. What would you make happen?
I would have it be seen. I
Yeah,
think that, I've heard so many amazing public health people over the years talk about how public health at its best is invisible, right? You don't
yeah,
see it, you don't think about, and I totally understand that. And at the same time, we have to have it be seen if it's going to be sustainable. And so that's my wish for public health, is that we bring it out of the shadows and both embrace it and celebrate it and continue to have it as really the bedrock of our society.
yeah.
For me, it would go to the workforce too. I think there's just such a need for skilled folks to come into the public health arena and the healthcare arena. If I had my magic wand, probably it would be I would triple the number of nurses our nation has. Right, our
Mm,
nurses are so critically important in a number of roles, and we just don't have enough. So that would be my wish.
love that.
Yeah, I was having trouble thinking of something, but Richard just kind of, besides nurses, so many of the problems that affect our community and pile onto people's lives, um, feed back into a shortage of not only clinical individuals, but mental health professionals.
Mm,
And the lack of mental health professionals that overlaps with so much of the work we do, and people pointing to, oh, this feeds into that. So yeah, bolster that workforce of so many different specialties that would help people in their lives and make our jobs easier.
yeah, right. Well, thank you so much. I love all those wishes. I wish, are in a position to grant them, but just really appreciate you guys, not only for your time here, but for what you do every day, truly. Um, let's make it more visible. So thank you for your time, and I guess we will sign off.
Thank you for having
Thank
us.
you.
Of
Thanks a
course.
Bye.
lot.
Bye.
Bye, everyone.